So Dr. Johnson, thanks for doing this with me. It's a real privilege for me to be able to do this. You were my attending when I was a senior medical student, and I can't believe that we're both here together, and so this means a lot to me. I think most people would really like to know just how you even got into orthopedics and how this all started for you, and what was like your first step, and how'd you get started?
Well, I was at the University of Utah in the general surgery program, and I was at a local affiliated hospital, and the chief resident had broken his ankle. I can't remember the injury, but he couldn't work, so they moved me up to chief resident, and I was in the operating room 5 nights in a row after midnight with local doctors who weren't surgeons, lysine bowel adhesions in a row, 5. I said, I can't do this. I was going to do general surgery and then do plastic surgery, because I'd done some work with a plastic surgeon in the lab. So one of my best friends was Skip Coleman, and his father was Sherm Coleman, who was head of the orthopedics at the University of Utah. So I went in his office and talked to her and said, listen, I'm not happy in general surgery. He said, I know you're not. You should have gone into orthopedics. I said, well, that's why I'm here. He said, well, where do you want to go? I said, I want to stay here. He says, you can't. I said, what? You're the chairman. What do you mean I can't? He said, you shouldn't do all your training at the same institution. You never learn anything that's not new and that's not done elsewhere. So he said, you go interview and you find the place, I'll write you a letter. So I interviewed all the California schools. And I got a call in December of my 3rd year, and I had gone in to visit these places in September. And my general surgery chief was Frank Moody, and he was, I wasn't happy that I was leaving, but he said, you got to do what you want to do. I got a call, and they said that one of their residents at UCLA had died in a mountain climbing accident. And could I take the spot, because I'd already passed internship and all that stuff. So I said, yeah, I can take it. He said, can you be here January 1st? So, well, I guess. So I packed up and drove down. And I was on call the first day. I was on call January 1st.
Of course you were, because you were the new guy.
And I didn't have any orthopedic training, and the splints I was putting on the tibia fractures looked like they had elephantiasis. They couldn't get out of bed. They're just like a Joe Palooka doll.
You ran out of plaster after your on call.
So, and I just met this fellow from South Africa, and we started nailing the femurs.
While you were at UCLA?
I was at UCLA. Yeah. And he said, you should do an AO fellowship.
So prior to that time, y'all weren't doing orthopedic, there was not, and this was just a visiting fellow who had been in touch with or trained by other AO surgeons.
Right, and he had put on AO courses in South Africa.
I see.
His name was Tony Headley.
And of course, he was my attending when I was with you guys as well. And so he essentially transformed your career as a result of that, doing that nailing of the femur.
Yep. And I got this fellowship, and I didn't even know where Hanover was, and I wasn't sure I should go because I really hadn't been anywhere out of the country.
How did you get into that slot of doing an AO fellowship? Did someone guide you there?
Tony Headley said you should do an AO fellowship.
I see.
And he said, I'll make a phone call. So I called Bill and Ager.
So that's how you were facilitated to Hanover.
And the best thing I ever did.
Well, tell us about the experience, the AO experience at Hanover. How did that further the transformation of?
Yeah, that was interesting, because as a fellow, you were just an assistant. You didn't really do the reductions or the plates. Mm-hmm. And Harold Cherney was very quiet. And the first Saturday I was in Hanover, had the strain pass, and I always wanted to go to the Pied Piper of Hamel. And it wasn't too far away, so I just took the train up. And as I got back to my room, I get a phone call from his secretary, who spoke fairly good English, Frau Delius. And she said, Dr. Cherney would like to take you to brunch tomorrow. I said, okay, and he'll pick you up at House B. I said, okay. And so he picks me up, and then I meet his family, and we're having brunch. And they were in 2 cars, so he was taking me back. And he said, "Are you busy this afternoon?" I said, "Well, I don't think so. I just got here." He said, "Would you mind coming to my office and help me correct my English slides? Because I have to go to Toronto to Marvin Tile's pelvic course." So he asked me, I need a word for, and his English wasn't really strong, but he said, "I need a word for hospital-acquired infections." I said, "Nosocomial." That's it. So then it got to be around Easter. So I was on a team. And they're all on teams and hierarchy, and then you had the Uberarts team director didn't get along with Harold very well. He was kind of an ornery guy. And Harold was, he'd have a Tuesday morning or Monday morning, he'd look at all the x-rays. And then there'd be rounds with him in the afternoon, and all the x-rays, since all the windows faced west, they would tape the x-rays on the windows by the patient. He'd look at it and he'd say, "Yeah, no, yeah." So there's one x-ray I won't say the guy's name, but there was one x-ray of a blade plate and a distal femur fracture. And the operating surgeon, who was the leader of his team, put the chisel in at 45 degrees to the axis of the femur. So when he put it down to the plate, we got a hyperextension deformity of the fracture, and he was just going crazy. I mean, you can, young bone, you can probably cut a new slot and add a screw or something. So he took I won't ever forget this, he took the blade plate out and got a bending press and bent a 40-degree curve just behind the blade. He stuck it in. And Dr. Cherney went ballistic. He's like doing this to him. And the guy was just kind of cowling down and looking around, trying to figure out a way to get out of the conference room. I won't forget that one. Then we just, he invited me to spend Easter in Austria. And he had Oberarts from Austria that had been with him their careers, and now they were out in a German hospital. Never got invited to go to Harold Cherney's house.
All for nosocomial.
Yeah.
You learned about the generosity of spirit because of nosocomial.
So I'm down there, and he had a place in Wagrain. It's south of Kitzbühel. And I went skiing with him. I got to know his whole family. And then I decided, well, Easter weekend, maybe I'll go over to Vienna and then I'll go down to Venice, because I have this pass. Get down to Venice, and I never paid any hotel rooms because I was just sleeping on the train. And I got the train leaving Sunday night. I guess it was Saturday night. Sunday night was going to Austria first, and it was full. But with the first class pass, you can still get on. So this American couple on their honeymoon said, "Oh, you can stay on the other bed in this room. It's okay." So they let me stay until 2 a.m. and I got off at.
That's another example of generosity of spirit.
Yeah. And I remember I was in Austria train station Trier, someplace like that, and I had to put my ski boots on. It was so cold. The only heat I had was my ski boots, which I had hauled from America, which was just stupid. And I had a ski suit and everything, and I'm just sitting at the train station waiting for the train to Hanover in my ski boots. And by myself sitting in the outdoors, because it wasn't an indoor station. It was a really miserable night.
So you went back to UCLA, and then you also had a great experience with Emile Letournel. Maybe you could tell us about how you used that, or how that came into your career.
This was '82, so I was on staff. I started on staff at UCLA, and I wanted to go to the Davos course. And I wanted to take the advanced course because they said, "Well, you can't because you haven't taken the course." I said I was in Hanover for 6 months on an AO fellowship. And finally, someone made a call and I got in the advanced course. And I had a great time. The invited guest was Graham. He wasn't really an operating surgeon. I forgot, he's an English guy. So I came back the next year. And it was Emile Letournel.
To Davos.
To Davos, yeah. So I'm sitting there in the lab with Emile, and he's looking at my pelvis, and he said, "Can I come and spend some time with you?" He said, yes. It's just write me a letter. So I wrote the letter, but I sent it to the wrong place. Because Emil was in line to be the chief at Sapieha, the very famous French hospital. And they gave it to a guy named Patel, some political connections. So they stuck him in this workman's compensation hospital in Port de Choisy. And it was a little bit different than trying to get privileges now. You know, you have to show licenses. So I just walked into his clinic, but I sent him a letter, said I'm coming, and he never got the letter.
Oh.
So I walked in the clinic, and he recognized me. He says, you're here? I said, yeah. He says, well, when they get the scrubs, we've got a case to do. So there was no checking of any documents.
You're good.
It's just, you're good, okay? And we had a pretty good time. I remember he would go up, so I spent 4 months there, and it was a little hard on family at home, but they forgave me. But they'd have lunch, and they'd have a bottle of wine. Everybody would have a glass of wine with their lunch. Then you go back to work. And if it was a successful day, then he would go out to La Bonne Table, the good table, and he'd be sitting there at like 11:30 at night singing, you know, La Vie en Rose with the chef and everybody. He was a character. Then he'd go sleep at the hospital until it was third Friday morning. Then he'd go off for the weekend outing. But we bonded pretty well.
So those two, Cherney and Letourneau, were and then Tony Headley had huge impacts on transforming your career.
That's right, exactly right.
And then, did you ever have interest in leaving UCLA, or is?
Well, like I said, I live in Dom's, and my wife wanted me to work for her father at his medical complex in Cerritos. And then Amstutz gave me a job. So that wasn't any reason to leave.
So you've seen a lot of transition over the last 40 years, and what do you think is the biggest thing that stands out to you that reflects the value of AO in the changing dynamics of the world today? Like, what is the value that keeps you coming back and keeps you sort of advocating for that group?
Well, I think if I had to come down to one thing, it'd be the camaraderie. And the modules for learning have changed significantly. Even during COVID, with the courses being done on Zoom electronically, they still have that sense. But I think being in the Alps or being at an AO course, and everybody at that course is your best friend during that course, and you can ask them for favors, you can ask them for a case. It's just generosity. It's just generosity spirit. That's what it is.
So the lifelong learning and the relationships have been the real
career
value.
The career relationships. Their career in the AO. Their career relationships. You have a friend in the AO. I mean, I can call up Sawaguchi about something, or Chris Morey, and talk to him on the phone, and they're more than happy to help. I mean, it's just an international communications, easy system of communication. And you keep your friends. They're friends for your life.
Is there anything else that you want to share with people about things that over the course of your career that you'd like to highlight?
Well, we started a course in Davos for the non-skiers afternoon. So it was like a 4 or 5 day course. And so the people who didn't go skiing, we would have like originally a solutions kind of course, where speakers would get up and show solutions to failures. And then I was since I was president of AO North America at the time, I was in on some of the international meetings with Tom Rudy, and they were trying to come up with a name of a course that would fit as an upper level course for more trained surgeons who come to Davos. And they didn't like the word solutions because it was kind of negative. So I said, well, I'll call it the master's course then. I said, master's course, that's a good name.
So that's where the master's
So the master's course came from there. And a lot of memories in Davos.
Still many more to make. So
still many more, that's right.
thank you for your time, and thanks for
So-
doing this, and thanks for being a great mentor for so many young surgeons that go into trauma, and for the durability and excellence of your career. I think everybody recognizes that, and we all thank you for that.
Well, I appreciate your long friendship with me, and I appreciate those comments. And AO made my career. It just made my career. That's all.
Right.
That's all it is.
Thank you very much.
You're welcome.
Okay.